I'm pleased to be joined today on Health Beat by Dr. Anton Simorov, a general surgeon with Faith Regional Physician Services General Surgery in Norfolk. And today we're talking about preventing colon cancer. So Dr. Simorov, what steps can we take to help prevent colon cancer?
Thank you for having me. This seems to be a prevalent issue, and seems to be patients are getting younger who are experiencing this problem. Usually it's something that will require surgery if it's truly a colon cancer, and that's where I would get called in. Let's say a gastroenterologist performs colonoscopy and finds a polyp or suspicious mass, biopsies, it turns out to be cancer. That's where I would get a phone call to come in and remove it.
The biopsy, can that be done quickly enough to where the patient is still under when you come in? How does that work?
For a patient, it's just a nap. They're going to sleep, They wake up, and it's done and over with.
Right. But if they do find that mass, they can biopsy that rather quickly?
We can perform a variety of procedures through the colonoscope itself, where we can take biopsies, tattoo the lesion, tattoo the area where we did perform that biopsy, remove a polyp. If it's let's say a bleeding polyp, we can burn it off, all through the colonoscopy for patients to be under anesthesia during the entire process.
I see. And at what intervals would a person expect to have a colonoscopy?
Nowadays, everybody recommended to get one at the age of 45, and if you don't have any predisposing conditions, if we don't find anything on it, then you're free to go for 10 years till you get another one.
And if you do find something, is it common to come back in a couple of years, or how do they?
Yeah, it depends on what we find. Intervals can be a little bit shorter if we have a degree of suspicion requiring coming back and checking on it again.
And the severity of what you find, I guess, dictates how often you would have to come back, or how quickly you would have to come back.
Correct, yeah. How concerned we are for, let's say, a polyp turning into cancer within the next 5 years.
So colon cancer, there's not a one treatment fits all in this type of a situation, I'm assuming.
Yeah, this is when we have to take a step back and perform a complete evaluation of the patient with scans, lab work, to kind of see where exactly we are in this process, how advanced this problem is. Can we just do a surgery, or do we have to do some kind of treatment before the surgery?
I see. So that would be a great topic for a further discussion with us, wouldn't it?
That's right.
All right. Thank you so much for being here today and sharing with our viewers.
Thank you.
You bet. To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.